Hi everyone, today we are doing posterior triangle of the neck. So this is basically a space on the side of the neck. So if you look at the neck from the lateral aspect, you'll notice there's a space like this, which is a triangle. This is the posterior triangle of the neck because it appears behind the sternocleidomastoid. This is sternocleidomastoid, which is a band-like muscle, a very important muscle of the neck. It extends from the mastoid process to the medial one-third of the clavicle as well as the sternum, the manubrium of the sternum to be precise. And yes, this is sternocleidomastoid. So behind that, there's a triangular region that is the posterior triangle of the neck because it is on the posterior aspect or the posterior border of the sternocleidomastoid. Then, so this is its interior boundary. The posterior boundary is lined by trapezius muscle. If you can recall, trapezius muscle is the muscle of the back that appeared somewhat like this. So this was the trapezius muscle. So yes, and its apex is at this superior nuchal lines where it meets at the where these both muscles meet at the superior nuchal line. So what are the muscles? Trapezius and sternocleidomastoid, right? And then the base is the interior one-third or two-third, you could say, two-third of the clavicle, right? Now, when you talk about, so these were the boundaries, but there is roof as well as the floor, right? So when you talk about the floor, we have four muscles. So what are those? First of all, it's not visible here, but you have semi-spinal capitis, semi-spinalis capitis. If you can see this muscle right here, this is my semi-spinalis capitis. See this one right here. So semispinalis capitis is there on the top. Then you can notice this is splenius capitis. Then you have levator scapulae, and then you have scalenius medius. Scalenius medius, right? So let's come again. What do we have? What are the muscles? You have semispinalis capitis. Then you have splenius capitis. You have levator scapulae. You have scalenius medius. You have to learn it as it is. There's no mnemonic for that. Moving forward, when you talk about the roof, so in the roof, there's this mnemonic plane. So P stands for platysma. You have platysma, which is another very important muscle. Then you have lymph vessels, supraclavicular lymph nodes. So what does this mean? This means that the roof is pierced by lymph vessels that finally end in the supraclavicular lymph nodes. So supraclavicular lymph nodes are present there, but in the roof there are lymph vessels that pierce it to finally end in supraclavicular lymph nodes. Then you have arteries. These arteries are unnamed from occipital artery, transverse cervical artery, and suprascapular artery. Let's see here. So the lymph nodes are lymph vessels which pierce the deep fascia to end in the supraclavicular node. So you have supraclavicular nodes. When you talk about the arteries, unnamed arteries derived from occipital, transverse cervical, and suprascapular. So supraclavicular lymph nodes, suprascapular artery. Then you have to talk about the nerves. So nerves you have again supraclavicular. So lymph node and nerves, they're quite the same. Sorry. So parts of nerves, you have parts of the supraclavicular nerve, great auricular nerve, and transverse cutaneous nerve, as well as lesser occipital nerve. So supraclavicular nerve, which is also the lymph node, great auricular nerve, transverse cutaneous nerve, and lesser occipital nerve. And then you have a very important external jugular vein, right? External jugular vein, I'll explain that to you as well. But for now, you need to know the roof, right? So let's go back and recap the boundaries and then we'll move to the contents. And yeah, so the posterior triangle is a space on the side of the neck situated behind the sternocleidomastoid muscle. Interior boundary is marked by sternocleidomastoid, posterior trapezius. Base is middle one-third of clavicle. I said two-third, but it is middle one-third. Then apex lies on the superior nuchal line where the trapezius and sternocleidomastoid meet. Roof is formed by the investing layer of deep cervical fascia. Here, there's a very important thing. The so basically you have deep cervical fascia has two parts. Deep cervical fascia has investing layer and a prevertebral fascia. So the investing layer of deep cervical fascia is what forms the roof. So investing layer, because you have whenever you're investing in something, you have to first of all invest at the roof of the house, right? So that's the way you can help learn this. So deep cervical fascia has two parts, investing layer and prevertebral fascia. Investing layer forms the roof of the posterior triangle of the neck. Prevertebral fascia forms the floor of the posterior triangle of the neck. Also, while I'm at this, let me just tell you about, let me just move forward in this book, and there's important point here. Yeah, here. you'll notice they're saying that prevertebral fascia forms the axillary sheath, pretracheal fascia suspends the thyroid gland. So now we know two things about prevertebral fascia. So investing layer of deep cervical fascia encloses two muscles, two salivary glands, forms two pulleys, encloses two spaces, forms roof of posterior triangle line. So investing layer of deep cervical fascia, it forms, it has all of these functions, right? Investing layer. So it has all of these functions, but other than that, it also forms the roof of posterior triangle of the neck. Prevertebral fascia, it forms the axillary sheath plus floor of posterior triangle of neck. And pretracheal fascia, it suspends the thyroid gland. So now you know about the deep cervical fascia. So deep cervical fascia, it has investing layer that forms the roof of posterior triangle. It has prevertebral fascia, which forms the floor of the posterior triangle of neck as well as axillary sheath, and it has pretracheal fascia, which suspends the thyroid gland. Right. Then moving backwards, so we have a roof. So it's a roof is formed by investing layer of deep cervical fascia, and then platysma is there. Then you have the lymph vessels which pierce the deep fascia to end in the supraclavicular nodes. A for you have unnamed arteries. Even if you just mention unnamed arteries, that's enough. But okay, occipital, transverse cervical, and suprascapular artery. Parts of the supraclavicular, great auricular, transcutaneous, and lesser occipital nerves, and lymph. Okay, and then you have E, which is external jugular vein. When talking about the external jugular vein, it lies deep to the platysma. External jugular vein lies deep to the platysma. And how is it formed? It's formed by, okay, here you can see this. This is a very good diagram that I've drawn. So you have retromandibular vein. So it has two parts, anterior and posterior. For now, remember the posterior part of the retromandibular vein. Then you have another vein, which is posterior auricular vein. So this posterior auricular vein, when it's coming, and the posterior part of retromandibular vein, they merge to form external jugular vein. So if they ask you about external jugular vein, it is formed by the union of the posterior branch of the retromandibular vein and the posterior auricular vein, right? So they both unite to form external jugular vein, posterior auricular behind the ear, and posterior part of the retromandibular vein. And further, external jugular vein, it has four tributaries, transverse cervical. So you can learn this with the help of tabs. Tabs. These are the four branches of the or tributaries of the external jugular vein. Transverse cervical, anterior jugular, posterior external jugular, and suprascapular, right? Posterior suprascapular. Also, this is a very um, good diagram. Here you can see you have retromandibular vein, right? So it was coming. Then it has an anterior division, so anterior branch of retromandibular. It has a posterior branch, posterior branch. Then here you had posterior auricular. So posterior auricular and posterior branch of retromandibular. They join together to form external jugular vein. So yes, an external jugular vein further has four divisions, tabs, right? And also you can see how it is crossing the sternocleidomastoid. It goes over the sternocleidomastoid and medially, and then it enters the inferior angle of the inferolateral angle of the posterior triangle of the neck. So this is the posterior triangle of the neck. So it enters the inferior angle, you can just say for now, right? Yeah, so we spoke about the external jugular vein. That's exactly what they were trying to tell here. It's from the union of posterior auricular vein and the posterior division of retromandibular vein. It begins within the lower part of the parotid gland, crosses the sternocleidomastoid obliquely, pierces the entero-inferior angle of the roof of the posterior triangle, and opens into the subclavian vein. It eventually opens into the subclavian vein, which is lying here. Right. Now continuing, this is the uh, subclavian vein, and this is external jugular vein. When you talk about the contents, it's important for you to know that this entire triangle, it is divided into two parts. This triangle is divided into two parts. One is, this division is done by the omohyoid muscles. It's inferior belly. The omohyoid muscle, it has different bellies. So it's inferior belly. It divides the posterior triangle of the neck into an upper part and the lower part. The upper part is the occipital part, and the lower part is known as the subclavian part or the subclavian part, and it also has another name which is supraclavicular. So omohyoid, it divides upper and lower. Upper is the occipital part and lower is the supraclavicular or subclavian. Subclavian or supraclavicular because it's right above this clavicle. Occipital part, it has cervical plexus, and the subclavian part, it has the brachial plexus because it is lower, right? And arms lie lower, and this is cervical plexus. So it's for like the cervical area and all that. You have cervical plexus, and here you have the brachial plexus. So that's one of the contents that you've already memorized. So you have subclavian portion, and you have a this is the subclavian portion, and then you have an occipital portion. Occipital portion has, it has the cervical plexus. This has the brachial plexus. Actually, this has the cutaneous branches of cervical plexus, not the entire cervical plexus, right? Okay. Now, when you talk about the occipital part, for that the mnemonic is Santa lags, maybe, maybe because lesion to rhomboids, TOSO, to and so, right? So this is a mnemonic that you need to learn. Santa lags, maybe because lesion to rhomboids, rhomboids to so, right? And then, yeah. So first of all, lax is the cutaneous branches of the cervical plexus. We're talking about the occipital part, so cervical plexus, cutaneous branches. So C2, C2, C3, C2, C3, C3, C4. Maybe because it's nothing, because this means we are further talking about the muscular branches. The next are next, at least here, these are the muscular branches. So this stands for nothing basically. So C2, C2, C3, C2, C3, 2, C2, 3, and then C3, C4, C3, C4, C3, C4. So C3 is happening three times, and C2, C3, C2, C3 is happening two times, and then C2 and C5, right? Now, first of all, you have your SANTA. SANTA stands for spinal accessory nerve, which is the 11th cranial nerve, and it supplies the sternocleidomastoid as well as the trapezius muscle, which is the shrugging muscle. They both are supplied by your accessory nerve. Then you have lesser occipital nerve because we're talking about the occipital part of the posterior triangle of the neck. Then you have the anterior cutaneous nerve. Then you have great auricular nerve. Now there is something I want to mention about great auricular nerve. Great auricular nerve, it goes to the parotid gland, and in the parotid gland it divides into anterior and posterior. We're talking about the great auricular nerve. It divides into anterior and posterior division. So then it forms a connecting branch to a very important nerve, auriculotemporal nerve. Now, auriculotemporal nerve, it has a lot of importance, especially in reference to the Frey syndrome. That is the clinical. Now, you may be wondering what is Frey syndrome. So here is this image. You can see Frey syndrome or gustatory sweating is a condition causing facial sweating, flushing, and warmth during eating or even thinking about food, usually due to nerve damage from the parotid gland, surgery, or trauma leading to misdirect nerve growth. Which is the nerve that's damaged? Injury to auriculotemporal nerve, a branch of the trigeminal nerve. Auriculotemporal nerve is a branch of the trigeminal nerve. So during the surgery of the parotid gland, there are chances that this nerve can be damaged, and it can lead to excessive sweating of this area, flushing of this area, and redness, right? So that is the Fraze syndrome. So it's related in the sense because great auricular nerve, it goes to the parotid gland, it gives anterior and posterior branches, and it also gives connecting branches to the auriculotemporal nerve. And auriculotemporal nerve, if it is damaged during parotid gland surgery, we'll have Fraze syndrome. Okay, so Santa was it was spinal accessory nerve, which is the cranial nerve 11. Then you have lesser occipital nerve, then you have anterior cutaneous nerve, then you have greater auricular nerve, which went to the parotid, anterior posterior, and then connecting branch was auriculotemporal, greater auricular. Then you have supraclavicular nerve, right? So supraclavicular, that's something you need to know. So just remember, in occipital part, we'll have supraclavicular. You may be wondering, and in subclavian part, we'll have suprascapular. Right here, you have clavicular nerve. Here you will have suprascapular nerve. You may be wondering that no, subclavian part is closer to the clavicle, so this should be supraclavicular, and the what do you call it? Scapula, it's above, so it should be here. Yeah, that way you're right. But for now, you need to remember that here is supraclavicular, and the lower part has suprascapular nerve, and also the artery, and also the vein. So suprascapular, everything is in the subclavian part, right? And also but in the subclavian part, we'll have supraclavicular lymph nodes, and we already know clavicular lymph nodes are present in the posterior triangle, right? In this entire region, we had especially the roof. When I was telling you that, let me go back here. When I was telling you about the roof, so I told you that the lymph vessels which pierce the deep fascia to end in the supraclavicular nodes. So it has supraclavicular nodes, And from the roof, the lymph vessels, they pierce the roof and then they had to drain into the supraclavicular lymph nodes. So for now, you need to know that. And also here you can see supraclavicular lymph nodes. That this is supraclavicular nerve. So muscular branches. What are the muscular branches you have? l- this is nerve to levator scapulae, then nerve to trapezius. So nerve to levator scapulae, nerve to trapezius, levator scapulae, trapezius. Then you have the nerve to rhomboids. Then the two is the vessels, and so is the lymph nodes. So you have transverse cervical artery, and you have occipital artery. You must have guessed, and vein. Then you have supraclavicular lymph nodes and occipital lymph nodes. If you can make this and write this down somewhere, and if you read it once, trust me, it will be easy for you to learn it. Otherwise, it does get kind of tricky. But yeah, if you keep revising, this will just stick into your memory. Subclavian part has everything that's very simple and basic, because everything starts with S. Let me just highlight that as well. So see S, S, then you have S, S, and you have S. So there's a lot of S here. Okay, so subclavian part, told you already it has brachial plexus, so let's just get that out of the way. And it has roots and trunks. Remember, brachial plexus has roots, trunks, divisions, and then roots, trunks, divisions, cords, and branches. Yes, so roots, trunks, divisions, and cords and branches. So the first two things, roots, trunks, they are present in the subclavian part, root and trunks of the brachial plexus. Then, because this is the initial part, right? Sort of. From this region, your brachial plexus is going to initiate. Then you have nerve to serratus anterior, which is a long thoracic nerve, and if this is damaged, it can cause winging of the scapula. You have nerve to subclavius, so nerve to serratus anterior, nerve to subclavius, suprascapular nerve, subclavian artery. Okay, suprascapular. Remember, I already told you nerve, artery, and vein, everything suprascapular. Very important. Then you have subclavian artery and vein, subclavian artery and vein. How could we forget that? And supraclavicular lymph nodes again here. So these three are very easy, and then you have external jugular vein. So you have roots and trunks of brachial plexus that we know. You also have subclavian artery and vein that we know. Then you had suprascapular artery, nerve, and vein, right? Sorry, this part had to be here. Then you have supraclavicular lymph nodes, correct? So these three are easy. And then you have external jugular vein, then you have brachial plexus done. You also have nerve to serratus anterior and you have nerve to subclavius. These are two things that you need to sort of learn, right? And here, what were the things with S so that you do not mix them up? This was easy because it had the entire wordings to it. Spinal accessory nerve, right? Then you had supraclavicular nerve. So there's nothing that you have to be confused about in supraclavicular. So there's no confusion of S. This here, serratus anterior and subclavius you need to recall. And yeah, that's pretty much it. That's the contents, and we are done. I'll just read off the book and I'll show you these diagrams once again. Here you can see this is the omohyoid inferior belly, right? And here, what do you need to see? You need to see that this is the omohyoid inferior belly and it is inferior, right? That's the reason it is like at the back of your, what are these muscles? This is sternocleidomastoid and not this one, sorry, this one. Sternocleidomastoid. Actually, it's also sternocleidomastoid. This is its sternal head, right? Right here you can see this is the clavicular head. So this omohyoid lies behind the trapezius as well as the sternocleidomastoid. And you can make that out right here. See, this is the omohyoid muscle. You can see how it is passing. And this is also the omohyoid muscle. It's cut down. This is the sternohyoid muscle. It's cut down. This is the sternohyoid muscle. And then you have sternothyroid muscle. So sternohyoid first, and then you have sternothyroid behind it. So sternohyoid first, and then sternothyroid. Okay. Now here in this diagram, is there something for us to know? This was the artery. I already showed you retromandibular posterior branch and posterior auricular. They make what? External jugular vein that drains into the subclavian artery. Sorry, vein. And these are the divisions you can see. They might also ask you to draw it. So yeah, is semispinalis capitis. Then you have your levator scapulae. No, you have your splenius capitis. Then you have levator scapulae. Then you have the what do you call it? Scalenius medius. Good. And then you can recall all the nerves. The lags are here. You can see, and this is the omohyoid, and then everything below omohyoid, and then you have the occipital part that has all of that center uh, lags, maybe lesion to rhomboids to so. rhomboids too, so and everything SS, 1, 2, 3, 4, 5, 6, 7 things in total in the subclavian part, right? So you just need to know all of that. External jugular vein was in the occipital, in the subclavian part, right? And it drains into the subclavian vein. Suprascapular nerve was also here. Then brachial plexus was also here. Subclavius was also here. Nerve to levator scapula was here. Did we have a nerve to levator scapula? Oh wait, levator scapula. Okay, anyways, yeah, here. Correct. Okay, now when you're done with this, let's just read the book and be done with it. These are the tributaries. That's the floor. You can already read it for yourself. I've repeated it so many times. And here you can see these are the clinicals. And yeah, that's the chart that you can have a look at and ensure that we're done with everything. Yep, so that's pretty much it.